Welcome to today's video segment. We have a patient here who we operated on 13 days ago. Both thighs, that is, a thigh lengthening with the Betz bow on both sides. We got up right on the day of the surgery. Then it's always standardized afterwards. That means we practiced it within the first few days. Walking with the forearm crutches. The patients are basically mobile at the ward level. Then the alternating step is practiced slowly. And within, let's say, the first 5 to 7 days, the patients are guided by physiotherapy to walk upstairs, to ride a bike, to do stretching exercises. After about 5, sometimes 7 days, we then start with the click mechanism, which means the lengthening phase. In the first 5 to 7 days, we let the whole system rest a bit. So now the patient can maybe tell us, first, how was the surgery for you? And second, how was it for you afterwards? That would be for those who are considering having a leg lengthening done. Very, very important to know.
Well, thank God I didn't experience the surgery itself. The next thing I noticed were the nurses who were taking care of me. 2 nurses were standing over me in front of me and were taking care of me. They were working on me, and then they were fiddling around. I also asked how I was doing. Yes, well, I felt really good. So that was really, I knew, of course, that the painkillers were still working, still very much, or that the after effects of the surgery are still there. Yes.
And then we got up with them.
Then you got up with me. Everything was still a bit wobbly, but for me, it wasn't a problem. I have to say, I'm relatively athletic.
You really did a great job. Most people feel a bit of nausea and dizziness. That's due to the medication from the surgery. It's not because you can't stand directly on the implants, but it's just that simple. That's due to the fact that you go vertical right after the surgery and your circulation needs a bit of time. Basically, no problem. What would be important or interesting now is how they manage their daily life. In other words, you are now about 2 weeks after the surgical leg lengthening. What can you do in your daily life? What can't you do yet? And how do you manage your daily life?
So my daily life looks like this. I'm fully employed. I work in an office. During the pandemic, I was able to work from home. This was done by the employer. It was even requested, and I've just continued with that. It means now, regarding the surgery, that yes, I took my laptop with me to the hospital.
And from there?
On the 4th day, I turned it back on and checked my emails. I called my colleagues, and that's basically my everyday life. On the side, in my hospital, sure. Of course, no household chores were done, but that's actually done by my husband.
That's right.
So I can say that right now I'm really managing to be fully employed.
Very good. It's important for all patients to know how much time does the click mechanism take? How much time of the day and how much time of the day does the patient take? The stretching exercises afterwards take up time. In general, you really have to say that the clicking, we recommend it in the morning, takes about half an hour. It takes 3/4 of an hour. You have to do it in a completely relaxed situation. You have to hold back a bit if possible. Spread out over the day. The stretching exercises take about 2.5 to 3 hours, which is something you should really be aware of. To be able to release the built-up tension from the extension in the muscular area, that's really, really important. That you have completely resolved it by the end of the day. This is now independent of the implant or the extension mechanism. It's the basis, so to speak. Any leg extension, you set the distance. With bone lengthening, so to speak, with bone distraction, as we say. And this predetermined distance has to be released during the day through stretching, that is, through stretching exercises. Otherwise, they sleep restlessly.
So you'll be motivated to relax or stretch for that reason, because when you feel the pulling, and I know after stretching, does it still pull or is it gone? And I feel a sense of relaxation in the muscle, then it's a certain joy. I think that it will certainly never be pure joy, but it just becomes part of everyday life. Just like brushing your teeth, it will become a part of your daily routine. At the moment, it's still a bit. I still need to organize it. But I think, and also these movements, they're not, well, for me, at least as a runner, I'm not that interested. I didn't know these stretching movements before. I can already tell that a routine is starting to creep in, that I just reach out so that I just have to think about it beforehand. How do I pull now and how do I do this? And that I can now also feel into the muscle.
Yes, very good.
So that I can already make some adjustments, that I notice how do I need to turn, that it is particularly effective. So there's also a learning process happening. I think it will become more effective.
Yes, definitely. Is there anything you can... Patients who are interested, what else would you like to add? For example, in the preparation, for example, where they would turn to or what they would do backwards, we can definitely recommend looking.
So I would definitely create a realistic picture for myself. I would like to see Dr. Becker at the earliest convenience because she was a realistic picture. I am at the beginning, but they keep reminding me that it's really going to be really tough. As I see it now, don't sugarcoat it, but really present a realistic picture. It's really a marathon. It's really exhausting. It's painful, and it actually implies that I can only get through it if I have the will, and that strong will. I want this. That's really important. Exactly. That and you really need to make that clear to yourself, that it's not going to be a walk in the park. Really not. Yes. So for me personally, it's like this. I know that it's painful, that it will get even more painful. Certainly. I'm also preparing for it. I'm not fooling myself. I'm also trying to be flexible. Me with the clicks, then maybe then 2. So right now I'm clicking 20, but I'm also preparing to reduce that. I will become very strong. Of course, the communication is happening between Dr. Becker and me, that I'm letting him give me some advice. Yes, I think this flexibility is also very important, that you also deviate from what you have in mind. You really should deal with the whole thing beforehand. That's very important. So that when you start, you also have in mind what's coming your way. When you make a decision, when you make the choice, you really stand there in self-responsibility. You really have to go through it yourself. The operation will be done. You have nothing to do with that. I think that will happen too. What am I assuming? Professionally done. But you have to walk this path yourself. You are accompanied and very well accompanied, but you have to walk it yourself.
What's important is that when you are discharged from the hospital, we only discharge you when certain things are met. What's essential is that they are okay in terms of pain and are managing well with their medications. In addition to the pain medication, there are also muscle relaxants and thrombosis prophylaxis. That's very, very important. The second point is that they are mobile on forearm crutches. That means they can also walk upstairs, ride a bike, and perform the stretching exercises independently. And the third point, which is very, very important, is that the clicking process works excellently. And everything worked excellently for them. For that reason, they could also leave the hospital a bit earlier.